Hello and welcome to More to the Story with Molly White. I'm so glad you joined me again today for another great episode. When I say great episodes, I really mean it. I know when you've been listening, we've had some incredible guests that have shared everything from their personal abortion experience to their professional experience when it comes to the life issue. And it's been so informative and encouraging. So I pray that you stay tuned in and invite all your friends, share this podcast with everyone you know as well, because they're going to want to hear our special guest today. Before I get started, I do want to thank our show sponsor, Dr. Stephen Hotze with the Hotze Health and Wellness Center. We really appreciate his sponsorship. And that just helps keep this podcast going. And for those who donate on a monthly basis, we really appreciate your donation as well. And we invite you to be a sponsor and a donor as well. And you can find that information on our website, moretothestory.org, or at for operationoutcry.org. You'll find some more information about doing that. Now I'd like to introduce my awesome, wonderful co-host, Mary Browning.
Thank you, Molly. It's good to be on the episode today. We do anticipate that in this episode, there'll be some information about abortion. And if you have experienced an abortion, or you know someone that has, or you've been touched by some trauma, you could find yourself triggered today. And if that occurs, we do hope you will go to operationoutcry.org and check out healing resources that are available there, or call the H3 helpline at 866-721-7881, and you will have 24/7. There are people answering the phone there and can talk to you. All right. Thank you, Molly.
Thank you, Mary. Well, we have Dr. Ingrid Skop, who is the Vice President and Director of Medical Affairs for Charlotte Lozier Institute. So welcome to More to the Story with Molly White, Dr. Skop. I always freak out over names. I'm so sorry.
It's great to be with you guys today.
Well, thank you for taking time to be with us. I look forward to our conversation. Now, can I call you Dr. Ingrid?
Of course. Easier to say.
Yes, it is. It is. So you are the Vice President and Director of Medical Affairs at the Charlotte Lozier Institute. With more than 30 years experience as a practicing OB-GYN to support research and policies that respect the dignity of every human life. You've got your degree, your Bachelor of Science in Psychology from Oklahoma State, and your doctorate from Washington University School of Medicine. And I'm going to kind of skip down here from your awesome resume. But prior to joining, after you've, I can't even go anymore. Just go ahead and introduce yourself. How's that? I'm sorry.
There's just a lot of details.
There's a lot of good stuff, and I thought, oh gosh, what do I leave out? Because
I would just point out that Charlotte Lozier Institute, for anyone who's not heard of it, is really the premier think tank looking at science and statistics on life issues. And as you mentioned, I've also been practicing as an OB-GYN in Texas, and I continue to practice. So I have a unique perspective. I'm doing the research, I'm seeing what the evidence shows, and I'm also helping women who've been personally impacted in the emergency rooms and in my office. So I have a heart for them. There's some really rough things going on.
Impacted by
abortion. Yeah.
Both surgical and the medical, the abortion drug. And
yes.
So when it kind of inspired you to join the Lozier Institute, because what you were experiencing in the emergency room, or how did all of this get started?
As an obstetrician, I'm pro-life because I love the complex developing unborn human, and I'm constantly surprised to hear my peers say otherwise. Mm-hmm. So of course, it's a privilege, but sometimes a burden to have two patients whose needs you need to consider, particularly during a pregnancy emergency. And yet I always will fight for both of my patients. But over the years, I recognize that not only does abortion end the life of one of my patients, but in so many cases, it injures my other patient, his mother, as well. I've seen women with really horrific complications, physical complications following abortion. I've cared for many women with mental health complications, anxiety, depression, substance abuse, even self-harm. And beyond that, I've just talked to so many women who've just been emotionally traumatized, even decades after the event. It will still bring tears to their eyes when they discuss it, the grief, the regret. So I think all of those things made me question the pro-abortion narrative that we hear from so many medical societies, including the predominant OBGYN medical society that is very pro-abortion. And I did my own research. I began speaking out. I've had the opportunity to testify in a number of states and at the federal level. And then eventually I wanted to do more research full time, and that's when I joined Charlotte Lozier Institute.
Okay, awesome. And we've had a lot of women on our program and men who have shared their abortion experiences. Mary and I both had that in our past as well. And talking about the emotional, the mental, and even the spiritual complications and side effects of that. But we haven't really talked a whole lot about the physical risks of abortion. We have talked mostly about surgical abortion, but can you just kind of go and give us a rundown of some of the risks with both types of abortions, both the surgical and the medical?
Yeah, absolutely. I mean, an early surgical abortion is a DNC procedure, which, most obstetricians have experience with this procedure, but there can be complications that can include bleeding, infection, surgical damage to the uterus, even uterine perforation or damage to surrounding organs, retained tissue. When you get into later surgical abortions, those are called a dilation, an evacuation, a D&E. And those are very complex. The uterus is enlarged. It has very vascular. It has a lot of blood flow. And if a doctor is not experienced in that procedure, it is quite easy to create a complication. And so there are more complications with those. Fortunately, there's far fewer of those, but they do continue to occur. And they do continue to cause some women to have severe complications requiring hysterectomy, and some women have even died. However, for about 25 years, the abortion industry has begun promoting medication abortion, which is two drugs. Mifepristone blocks progesterone. It cuts off the critical support for the unborn child and causes him to die. It's followed usually about 24 hours later by misoprostol that induces labor to expel the pregnancy tissue. So I'm sure we'll talk about that in detail. But one thing to be aware of is that studies tell us there are 4 times as many complications from medical abortions compared to surgical. So all the horrible things that I just told you that can happen with surgical, it happens 4 times as frequent after medical abortions. A lot of times it fails to cause a complete abortion. So the women continue to suffer pain, bleeding, because they have retained tissue their body can't expel. And we see probably about 1 out of 20 women go to an emergency room because of those complications. A similar number need surgery to resolve the abortion, to complete the process. It's not the same as if she chose a surgery in the first place, because she's been dealing with the complication for sometimes months before they finally seek help.
And the difference too is when you have a surgical abortion, you're in a facility, a medical facility, quote unquote. And when you have a chemical abortion, the mifepristone, you're at home most of the time. You're at home, or you take the pill and you think, oh, nothing's happened, and you're out and about, maybe going to school, going to Walmart, whatever, and all of a sudden it hits you, and you're delivering your baby in a bathroom, either in your home or riskier. There's no medical team around you. There's no one there to help you. So I can see where it's a lot riskier for a woman.
Yeah, the abortion industry could turn to these pills because they were having a staffing problem. They couldn't find enough obstetricians willing to end that unborn life. And so they've outsourced the action to the women. And as you mentioned, this is essentially self-managed abortion, which before Roe we were told was a bad thing, but now they're backpedaling to try to make it seem like it's a real empowering thing for women. But I'll tell you, so many of these women, after going through this horrendous process, they see their child.
Yeah.
They see the child they've chosen to abort. And I just don't think we can ever quantify the mental health harm that comes from that.
Yeah. It's pretty severe. And what we're seeing, Mary and I are seeing on this end, and even abortion recovery programs and abortion hotlines, is they're getting calls a lot quicker with the medical, the mifepristone, the abortion drugs, than women who might call and need help after a surgical abortion. Sometimes that takes years, for women to realize, hey, I'm suffering. It's because I've had an abortion 15 years ago, as opposed to a woman who's taking the drugs and she may even be going through the abortion when she's calling for help, a hotline or something. So the response time, I think, or the mental anguish that's happens a lot sooner.
Yeah.
Doctor, I'd like to ask you a question because I saw recently in the news that the FDA is going to re-examine the question of this abortion pill on the market. And do you have an observation, or what would you like to see from that re-examination?
Well, I'm optimistic to hear that they are going to re-examine this. There's a couple of things to be aware of. One, the FDA, for ideologic reasons, time and time again has taken away really critical safeguards on these drugs. When they were initially approved, it was only until 7 weeks. It had to be a doctor. There had to be 3 visits, 2 before and 1 after. And in 2016, they said, oh, it doesn't need to be a doctor. They extended it to 10 weeks. They actually, at that time, took away the requirement for reporting complications. So they said, you don't even have to tell us unless it kills a woman. And then unfortunately, during the COVID pandemic in 2021, they said it's too dangerous for a healthy pregnant woman to go to a clinic, which was incorrect. But they used that to justify removing the in-person prescribing requirement. So initially that was so it could be prescribed by telemedicine. But today, and of course that's still in existence, there's no requirement. It's being ordered online, sometimes from international distributors. It's being sent in the mail into pro-life states like mine. Nobody knows how to stop this. And so women are having totally unsupervised abortions. There's no testing in advance. Nobody's doing an ultrasound to discover, could she have an ectopic pregnancy? Is she really the gestational age that she thinks, or could she be 2 months further along? So of course that's going to increase complications if a woman takes it at a more advanced gestational age. So all of that has happened. And so we've been crying out for years, please, FDA, look at what you've done and do studies, find out what's happening in the real world today because of these changes. But another critical thing for your audience to know is, as I mentioned, there is no mandatory reporting on abortion in our country at a federal level. We don't know the numbers, we don't know the complications, and we don't know the deaths that occur. Because if we're anticipating the abortion industry is going to voluntarily report their own complications, then we're highly naive.
Yeah.
And so I'm hopeful and optimistic, but I think it's important that the FDA needs to look at a fresh data source. They can't go back to the pro-abortion studies published by the abortion industry, which, by the way, those studies usually will tell you how many abortions they've sold, but they don't know all of the outcomes because many women don't come back. So often 15, 30, even 50% of the women that they sold abortions to are missing. Their outcomes are unknown, and yet somehow they still publish studies indicating that it's safe. So you may be aware of a report from the Ethics and Public Policy recently. They looked at a very large insurance database. And the critical thing about an insurance database is you can find out who the abortions that were paid for and the subsequent events that occur. So you can link those two, and you find a much more accurate indication of how often complications are occurring.
Right. Well, and even even if a woman did call the clinic where she had her abortion because she's having complications, they say, well, you're not our problem anymore. Go somewhere else, you know.
Yeah, absolutely. I've tried to call them when I've cared for their patients and said, I think you want to know about this problem, and they won't talk to me. So yeah, they're not looking to find out.
Mm.
And of course, they're selling these drugs as safer than Tylenol. So women are surprised when they have a complication. They're not going to go back to that abortionist who lied to them.
Yeah.
So what they do is they come to an emergency room, and that's where I've seen them. And also, it's very important to know that when they come to the emergency room, they often do not tell the doctor that they've taken these drugs. There are several reasons for this. One is, as you mentioned earlier, they're ashamed. They don't want people to know. And sadly, some of these women have told me, yeah, Dr. Skop, I think this is what I deserved for making this choice. So they feel that this is maybe God judging them or what they think. They don't want to talk about it. But also, the abortion industry actively tells them, you don't need to tell the doctor. You can keep this information from them. And a third reason they don't tell is because they've falsely given many women the impression in pro-life states that they will be prosecuted for having an abortion.
Yeah.
No state will prosecute a woman. We consider the second victim of abortion. And yet that fear of prosecution apparently has led to deaths. ProPublica documented a woman who would not go to the emergency room because of that inappropriate fear, and she died of complications of the abortion drugs. Not the state's pro-life policy, but the fact that she took these drugs and then did not seek help when she had a complication.
That's just criminal all the way around. They need to be held accountable for that. Mary, did you have a question?
I had a question just about, Doctor, you mentioned even in the states that are pro-life, but is there other misinformation that's being put out there by the abortion industry about maternal mortality or whether or not a person can get good medical care?
Well, we've seen since the Dobbs decision, all the abortion industry has is lies and misinformation, because it will certainly be the case for many reasons. I think that these laws will not only protect babies, they will protect their mothers, primarily because doctors won't be looking to abortion as a solution to problems and will be forced to come up with new ways to help women and to treat women. And I do want to mention before we get off the miscoding of the abortion drugs, at Charlotte Lozier, we did a records linkage study, documented that 84% of the time when women come into the ERs with complications, they are coded as a miscarriage. So that's how often it's happening. More than 4 out of 5 women are not telling the doctors what's going on. And the doctors, when they don't know what's going on, they do not provide as good a care. Our studies have also demonstrated these women, on average, took about 3 visits to the emergency room before they finally got surgery, which was what they needed. But yeah, Mary, to your question, we've all seen it. It started immediately after the Dobbs decision. Maternal mortality is going to increase. Doctors won't be able to provide quality care. Well, one thing I do want to let you know, the United States has the worst maternal mortality in the developed world. And that is not a new problem since Dobbs. That is a decades-old problem when we had wide open abortion for any reason at any time really in pregnancies. We had no limitations on abortion in the Roe era. It was not protecting women. Women were already suffering and dying related to pregnancy. Maternal mortality is somewhat complex. It can be a death that occurs during the pregnancy, at the time of delivery, or up to a year after the end of the pregnancy. And the things that we think of, like a hemorrhage or a sepsis, some catastrophic event in childbirth, the good news is those deaths are decreasing. Doctors are doing a much better job. We've got protocols, we do drills, we do all that we can so that we can work as a team in an emergency. And that only accounts for about a quarter of the deaths in the United States related to maternity. Another quarter are mental health deaths. We've got a population there's anxiety, depression, substance abuse is so common. And so many of the deaths are related to that. And I would say a lot of deaths are also related to the fact that women many times are unhealthy when they become pregnant. we're all aware of the MAHA movement wanting to make America healthy again. Well, we need that for our moms, because so often they may be older moms, they're chronic hypertensive or diabetic or obese, and their risk is higher just, from the beginning because of their chronic medical illnesses. So that lie has been spread. And of course, many people believed it, but fortunately we're starting to get data now of what happened from the year 2022 to 2023 when these laws were implemented, and maternal mortality is going down. So the good news is it was a lie, it was a false narrative, and it has not been proven true. And I anticipate that maternal mortality will continue to improve in pro-life states as we give better care to women in pregnancy.
Awesome. Well, ever since the Roe v. Wade, that was built on lies and deception, and everything about the abortion industry has never been based on true scientific facts. It's always been lies and fear tactics. But one question I had too, and a concern, is when women or whoever orders these mifepristone drugs off the internet and they're coming from no telling where, what's really in those drugs? Really a good quality drug? Are they laced with something else? Are they, so for me, I would never take a drug coming in from anybody else, because I wouldn't know how safe that whole drug was in the first place.
Yeah, absolutely. Some of them come from India, and prior studies have documented that when they analyzed the drugs, in some cases they had only 17% of the advertised amount of the abortion drug. So yeah, so you have to worry about the quality. Sometimes they come without labels, without package inserts, without, what is it in this drug? Of course, we all know that fentanyl, there is a concern.
Yeah.
Yes.
They can be used as a bioweapon to start killing off people, women and their babies. When you're ordering something online, I mean, how dangerous that can be. But let's talk a little bit about, the health risk. But do we have any data that would point to long-term health risk from taking these drugs?
There's been very little curiosity, not surprisingly, by the abortion industry, who publishes most of the research. But there are some things to consider. We've known, and really this is not controversial, even in the mainstream OBGYN that a surgical abortion can damage a cervix, so that when a woman wants to go to term with a subsequent pregnancy, that weakened cervix may go into labor prematurely. So it's well documented that women are at higher risk for premature delivery after surgical abortions. But there's some data to indicate that if a woman starts the process medically and ends up having to have a surgery, which, as I mentioned, occurs at least 1 out of 20 times, her risk of having a preterm delivery the next time goes up by a multiple of 3. So, so that is a very much a concern. The chronic inflammation that occurs when this retained tissue is there for a while, could it cause scarring of the uterus? Could it cause potentially abnormal placental implantation when she does get pregnant again? Absolutely, it could. But again, very few people we're not even doing good short-term complication, investigation. Nobody really is looking at the long-term. But there is concerns about that this process, emotionally, does a mom bond as well with subsequent children when she's chosen to end the life of previous children? We don't know, but I think that's a legitimate concern. So there's so many questions at Charlotte Lozier. We're trying our best, but there's not a lot of us. But we really, as a society, we need to be asking these questions if we care about women and if we care about children.
And our future fertility rate, yes.
Exactly.
And I don't know if the Charlotte Lozier Institute dives into the breast cancer risks of abortion, because it just has to make sense. And I've been with breast cancer researchers, breast cancer surgeons, speaking at the United Nations, and all the studies. I mean, there's many worldwide studies out there that link, especially a first pregnancy, first trimester abortion to breast cancer. Why? Because when you get pregnant and start to conceive, then your breasts start to prepare to provide milk when this baby is born. And so your cells in your breast are rapidly developing. And if you end that pregnancy, then these cells become stagnant or possible to create breast cancer. So have y'all spent any time in research on that fact?
We have not done that ourselves, but we are aware of the research that's been done. Angela Lanfrancini
Yeah, I
and
know it.
Joel Brend are very well known. They have really looked into this, and I would say there's two considerations. One that is not controversial at all. This has been known since the Middle Ages, when it was documented that a nun was more likely to develop breast cancer than a mother. So we've known that giving birth and breastfeeding, having that process bring the breast to maturity protects a woman against breast cancer. That is not controversial in any way. But what you mentioned, the idea that the breasts are being stimulated appropriately from normal hormones, and then those hormones are abruptly cut off, that could leave the breast tissue in an undifferentiated state. It hasn't gone through that maturation process, and that can leave those cells more susceptible to breast cancer. So that's the mechanism that has been postulated. The problem, again, the studies are so bad, but the big problem is that the time of the abortion until the time that a woman develops breast cancer is usually decades.
Mhm.
And there's so many other factors that can be involved that it's very hard to separate that out. But it is definite. I mean, the groups that have the highest abortion rates in our country, unfortunately, is Black women. They have 3 times the abortions compared to white women. They also have extraordinarily high incidence of breast cancer and mortality from breast cancer. So again, we should want to know the answer to this question. 1 in 4 women in America has had an abortion. 1 in 8 women develop breast cancer in their life. So if we're increasing their risk, we absolutely should try to find out that information.
Need lots more research of that. And it's not saying that every woman who's had an abortion is going to get breast cancer or vice versa. We're not saying that, but there is an increased risk. And there's, like you said, there are other factors to that as well. But I think it's information. Women deserve all of the information out there of short-term, long-term potential risk when we're making a decision to have an abortion.
Yeah, you're right. I mean, informed counseling is not occurring at all, especially when they're ordering it off of a website that gives them no information at all.
Right. Absolutely.
I want to mention too, I'm afraid some of the research is not as available as it could be, because people like me haven't been honest about our medical history. We haven't told. Thankfully, I haven't been diagnosed with breast cancer, but 10 years ago or 15 years ago, when I wasn't honest about my own experience, then if I had been diagnosed, the link wouldn't even be available. So I just want to mention to our listeners that if you have abortion in your past, please note it on your medical form. So in the future, that information can be compiled and we can see what the linkage is. I feel like women have been hurting ourselves here. And it really hurts me to think that a lot of women are the biggest proponents now of the pill. So anyway, I just wanted to say that I just feel a little guilty sitting with you, doctor, knowing I filled out forms. How many pregnancies have you had? And for years, I was not honest with that. I didn't even really think about it as being dishonest. I just really didn't think about it as, well, of course, there was a pregnancy that didn't come to life. But so I just want to mention that for our listeners.
Yeah,
And
that's
that
a good
question
point.
is really, a question. Well, I guess the question about how many pregnancies you have is on forms, but they don't ask if you've had an abortion, surgical or medical. That might have been spurring. But so there's just a lot of lack of information out there. And Dr. Ingrid, we only have just a few minutes left on the show, and it's been so informative. But what would you like for our listeners to take away from this conversation, especially about the abortion drug?
Well, I think I would love to see people start questioning the narrative that they've been told, and trying to find their own information to educate themselves, because so many women are under the impression that women need this. They're not realizing that it's often harmful to women. So, again, come to the Charlotte Lozier Institute website. We've got 1,000 documents, I'm told, on that website. So there's quite a bit of information there. But just educating ourselves, educating our friends, talking to our pastors. I think the church does not address this issue the way that they should, especially with the knowledge that there are women sitting in the pews who have an abortion on their conscience. They've never confessed to God. They've never asked forgiveness. So the pastors need to recognize that their flock is suffering. But yes, regarding these abortion drugs, just anyone that you ever encounter who might be considering, just let them know these are not safer than Tylenol. These can be quite devastating, and particularly the experience for women, the trauma for women. How many women are going to have post-traumatic stress disorder from this horrible process? We have no idea, but it's so harmful.
Well, thank you. And yes, we just want to let everyone know that's listening, like Dr. Ingrid said, get informed. Get informed before you take any drug or have any kind of surgery. And then we've got more pregnancy resource centers in our country than we have abortion providers. And there's help and hope for you out there during this vulnerable time of pregnancy. So don't make any long-term decisions, in a quick fashion. Get some counseling, get some help. Go to operationoutcry.org. There are resources there for you as well. And if you've had an abortion, Mary and I talk about this all the time. We have affidavits or declarations on the operationoutcry.org website. We're ask questions about your abortion experience, and you can fill that out. Sometimes that's the beginning of your healing journey. And this information, whether you use your full name or partial name or just your initials, this information can be so educational for groups like the Charlotte Lozier Institute, for lawmakers, for attorneys, to educate them on really the harm of abortion. So we invite you to go to operationoutcry.org and fill out a declaration. So we're out of time. It was very, very informative. Thank you, Dr. Ingrid,
Thank you, Doctor,
on today and sharing with us this important information. Thank you, Mary, and thank you all for listening in to More to the Story with Molly White. We'll see you next time. God bless you. Bye-bye.
Thank you.
Hello, friend. Our broadcasting wanted to take a moment to personally thank you for being a listener of the More to the Story podcast. Whether you're a longtime subscriber or just found us, we're so glad you're here. This podcast is a community built on sharing, and that's where you come in. If an episode has ever resonated with you, please consider sharing it. Text it to a friend. Post it on social media. Your recommendation is the most powerful way to help these important stories reach new ears. We are also inviting businesses and individuals to partner with us as official sponsors. Sponsoring the podcast is a wonderful way to reach a dedicated, thoughtful audience while directly supporting our mission. If you'd like to explore sponsoring the podcast, we invite you to visit our website at www.moretothestorypodcast.org. Again, that's www.moretothestorypodcast.org. Thank you for being a part of our story.